I'm Nicole Goyle, and I'm here with my husband, Dr. Ashu Goyle, and today we are talking about regenerative medicine. I'm not sure if you're familiar with this, but regenerative medicine seems to be a buzzword lately. I'm seeing it in magazines, online, and really want to kind of get down to what exactly regenerative medicine is and how it can help people who are dealing with chronic and acute pain.
So regenerative medicine is the field of medicine where we use the body's own natural ability to heal itself and ideally regenerate injured tissues.
Okay.
So this is really coming down to the basic of wound healing.
Okay.
So when you cut yourself,
Yes,
you have a wound.
absolutely.
Right? Your body has this natural ability to let that wound heal.
Right.
We can harness some of that power.
Okay.
And apply it to more serious injuries. For example, in pain management, we use PRP, which is platelet-rich plasma. So this platelet-rich plasma it comes from your own blood. We take your blood, we spin it in a centrifuge, and we concentrate growth factors and anti-inflammatory chemicals that are floating around in your body naturally.
Okay.
We concentrate them to the point where if they're introduced to injured areas, they can stimulate and accelerate the healing process.
Wonderful. So who would be a candidate for regenerative medicine?
So the level 1 evidence we have for regenerative medicine right now is for knee osteoarthritis, so patients who have knee pain, and if it's secondary to osteoarthritis, they may be a good candidate. Tennis elbow, golfer's elbow, which is a pain in the elbow area that's caused by repetitive use. We can develop what's called a tendinitis or a tendinopathy. And so that's injury or inflammation of the tendon. So we can apply PRP to those areas and help those areas heal.
Okay. So when a patient comes in, and you examine them, you decide that they are a candidate for PRP, the regenerative medicine, what does that process look like?
Well, I think one of the first things I stress is that regenerative medicine is not pixie dust. It's not going to work for everyone, and that's the biggest caveat that I think needs to be mentioned. Yeah, I see, for example, I saw an 82-year-old woman in my clinic just this week, and she's got severe osteoarthritis in her cervical spine. And she's failed a lot of therapies, and she specifically came to me for regenerative medicine. And unfortunately, that's not a good candidate for regenerative medicine. Once there's no longer any tissue, then I think you've gone beyond what regenerative medicine can provide. So regenerative medicine is really helpful for acute injuries, right? Acute tendon injuries, sprains, things of that nature. It can also be helpful for some chronic conditions, like I was mentioning, the osteoarthritis. So knee osteoarthritis, and if it can work in the knee, it can work in other joints as well. They just haven't done the long-term studies for that. But so the process involves a patient coming in. I give them options, like I always do. And if they're specifically wanting to stay away from more of the traditional medicine, the corticosteroids, medications, and they're looking for more of a long-term solution, that's when we have the conversation about regenerative medicine. And so I'll see people who have osteoarthritis, and they say, look, I don't want to put steroids in my knee because I'm a brittle diabetic or I have other health conditions, and there are contraindications to the normal traditional modalities that we use to treat these issues. So then we'll start talking about the regenerative medicine options.
So regenerative medicine is just really, it's your body healing itself.
Yes, exactly.
Wonderful.
It's tools that we use to help the body heal itself.
Wonderful. And then what is the downtime after you have the procedure? What should a patient look out for, as far as recovery?
So I'll give you an example. So let's say we're treating knee osteoarthritis. Typically when we do these procedures, there can be there can be a pro-inflammatory reaction that occurs. And so sometimes the pain increases before it gets better. And that's normal. So that's your body stimulating the healing process. And so typically I do a regenerative medicine procedure. I have patients take it easy for a week. Treat the area like you just had surgery. Limit weight bearing, limit activity. If you can immobilize the area, do that, but for no longer than a week. And then aggressive physical therapy.
Okay.
Results are typically seen between week 6 to week 12.
Okay.
So I do have a handful of patients who respond sooner,
Okay.
but most commonly it's 6 to 12 weeks.
So is there anything that patients can do at home that will help give them better results with their PRP that you've done?
Yeah, that's a great question. So typically, even before we do PRP, I have a pre-procedure protocol that I like patients to follow, which really comes down to cleaning up their diet, low fat, more of an anti-inflammatory diet, limiting alcohol intake. If they're smokers, it's really a bad idea to undergo regenerative medicine because the cells are toxic and we're going to be using toxic cells to re-inject into an area that's injured. So I advise patients to stop smoking for at least 4 to 6 weeks prior to undergoing any regenerative therapies. But then it's hydration, it's activity as tolerated. We do the procedure, and then for the week after, continue those healthy lifestyle. I mean, it really comes down to living a healthy lifestyle.
Wonderful. Well, and what's nice about regenerative medicine is that you can use it not only to heal your joints and injuries, but you can also use it for aesthetics. So that's kind of where I come into play in our practice. I do all of our regenerative aesthetics, and some of those services that we do together are PRP facials. So you're basically doing the skin pen microneedling, and you're adding the PRP to the process, which helps to, again, stimulate basically new cell growth, new skin growth, and
collagen,
just
fibrin,
exactly. How you explained that, when you have a cut and your skin is basically growing new tissue, that's also what's happening when you're doing the skin needling.
So it's a great alternative to Botox for patients who don't want to put Botox in their face. They can do this, which has kind of a similar effect, and it's more natural.
And you can start it at a young age and really use it as a preventative measure. It's also great for people who have acne and acne scars. It helps to, we've seen in 6 treatments, it clear up all of their acne scars, or at least reduce most of the appearance of the acne scars. So yeah, it's a great, regenerative medicine just seems like it has so many incredible benefits.
Yeah, and of course they do extend beyond the pain world, but that's a different topic for another day. But yeah, that's our duo. Look good, feel good.
Absolutely. Well, Dr. Goyle, thank you so much for speaking with us today and answering all of the questions about regenerative medicine, and I look forward to talking with you more about more topics.
Great, thank you, Nikki.
Thank you.